Thanks for joining us today. Welcome to the Center for States video series on implementation planning and capacity building. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Implementation Planning and Capacity Building Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to planning the implementation of an activity, program, or intervention to address a problem or need, and consider strategies to building agency capacity to implement it. It does this by providing step-by-step guidance to prepare for implementation, make a plan for addressing any gaps in capacity or capitalizing on strengths, and then develop a plan for implementation that includes the actions needed to get ready, actions needed to implement, and actions to measure implementation progress. Implementation planning and capacity building is broken down into 3 parts and 8 essential functions or steps that may be presented linearly, but they often overlap and teams will loop back and forth between them. At this point, teams should have outlined the elements to include in their plan, identified the sources to pull the information from and considered the context, then revisited their teaming and leadership structure, reviewed readiness assessment findings, developed strategies to build capacity and strengthen motivation for implementation, identified work plan activities to get the intervention and agency ready to implement, and work plan activities to roll out the intervention and measure it, as well as identified communication and engagement activities. In this module, we will look at consolidation and review of the implementation plan. Let's get started. Once teams have completed the work of an implementation plan, including detailed work plans, it's important for team members to do a comprehensive review of the plan and consolidate where needed. This helps to ensure that the plan is consistent and cohesive throughout, that it includes all of the necessary information and that all of the parts are aligned, that the sequencing is logical and reasonable for the agency to carry out, and to ensure that it is reviewed by all stakeholder groups, including partner organizations, staff that may carry out the intervention, and members of the target population who may receive the services. To complete the implementation plan, teams pull together information from various sources and integrate it into a cohesive document. It is important for teams to remember that this plan may be further refined and revised over time as new developments occur and related plans are developed. Teams should ensure that all necessary action steps planned for completion before and during implementation are documented along with timelines and milestones, and think critically about how they reflect the following elements: the team's problem statement and theory of change, the selected intervention, its evidence base, and needs for further design or adaptation, levels of motivation and capacity as reflected in a readiness assessment, goals and approaches for implementation, for example, any pilot testing or staging, and evaluation needs and plans. Teams should check for consistency across sections and address any gaps. And they should carefully review the sequencing of activities to ensure that there is a logical and reasonable flow and that action steps reflect available resources. For example, if there are multiple sites or multiple interventions, they should think critically about whether they are sequenced to build on and support each other and not overwhelm those providing or receiving services. In partnership with stakeholders, teams should identify potential barriers or challenges to implementation, any associated risks, and outline proactive strategies to address them. During this process, teams may revisit barriers identified in the review of readiness findings and the capacity building strategies developed to address them, as well as identify others. Barriers might include things like a leadership turnover, changes in anticipated funding, competing staff priorities, or another obstacle that slows down intended plans. Risks are how the barriers or challenges might impact efforts. But risks can also come from hasty decision-making or ambitious plans for implementation. Often these types of risks can be reduced by planning for piloting or testing to gather feedback on the effort before larger-scale implementation. Potential solutions are proactive strategies that can keep the plan moving in the event that a major barrier or challenge comes up during implementation. While it's impossible to anticipate every potential obstacle, proactive planning will help reduce any knee-jerk responses and unnecessary interruptions. For example, having a transition plan in place, or using shared leadership approaches to minimize disruption. Bringing stakeholders into the planning process can support smoother implementation, increase motivation and buy-in for the process, and bring in vital perspectives on how implementation might work. Selected stakeholder groups, including external partner organizations and members of the target population, should have opportunities to review and provide input on the implementation plan. Following integration of that feedback and completion of the plan draft, team members typically need to submit and discuss the plan with appropriate leadership groups. Teams should ensure that leaders understand and agree with planned activities, timeframes, and resources required for the new intervention. What can help teams to consolidate and review the implementation plan? Teams should thoroughly review the plan and the different pieces that have shaped it, such as the theory of change and readiness findings, as well as identify any gaps they may have missed. They should gain consensus on the different steps in the plan and the sequencing. Does it make sense for all stakeholders? Any additions or changes should be agreed upon. And teams should gather input from all team members and stakeholder groups on potential barriers and challenges, as well as strategies to minimize disruption of the plan. Let's take another look at the Illinois Permanency Innovations Initiative plan to see how the team looked at potential barriers, risks, and strategies to move forward. The team outlined several potential barriers and risks and their proposed strategies to continue to move forward with the plan, including limited participation, securing resources, and turnover. But let's take a more in-depth look at one of those examples. Part of the program being implemented included videotaping of client participant sessions. They anticipated there might be a certain percentage of clients that would not want to be videotaped, risking losing data and fidelity for the intervention. So they proactively outlined the specific strategies that would be used to continue to move forward, including explaining clearly the purpose of the videotaping and confidentiality requirements, offering audio taping as an alternative, and offering services but including a written report that addressed the needs of the fidelity checklist for the intervention being implemented. While the number of participants who refused may have been minimal, the team's ability to proactively account for this barrier and integrate supportive strategies into the implementation plan would have likely reduced any delay in services as a result. Now that we have completed all the modules in this series, let's check in on a few key milestones teams should have in place before moving forward. They should have a team with diverse expertise and representation to guide the change and implementation process. The team should have a clearly identified problem and an analysis of the root cause or causes of the problem. They should have a theory of change that reflects a clear pathway from the problem to a desired long-term outcome. They have identified, adapted, or designed an appropriate intervention that is well-defined, a good fit, and is feasible within the agency's system. They should have readiness assessment findings that include the areas of strength and capacity needs for the selected intervention or interventions, and have a comprehensive implementation plan that incorporates plans to build needed capacities for implementation. Taking the time to ensure that these key milestones are in place before moving into intervention testing, piloting, and staging will increase the likelihood of successful implementation of the change initiative. Let's take a moment to check in on what you've learned about consolidating and reviewing the implementation plan. Why do teams consolidate and review the implementation plan? To lay the groundwork for implementation success, ensure it is consistent and cohesive, that the parts are aligned and sequencing is logical, and that stakeholder perspectives are represented. How do teams consolidate and review the implementation plan? By integrating information, reviewing sequencing, identifying barriers or challenges, and then coordinating stakeholder reviews, integrating feedback, and getting leadership approval. What can help teams consolidate and review the implementation plan? Considering the elements that shape the plan and identifying any gaps, gaining team consensus on sequencing and changes, and getting team and stakeholder input on potential barriers, challenges, and solutions. Now take this a step further by reviewing the reflection questions for Consolidate and Review the Implementation Plan in your Implementation Planning and Capacity Building Workbook to connect what you've learned to your own experience. As a recap, the 3 major sections and 8 essential functions in this video series on implementation and planning and capacity building include Part 1, Preparation, with essential functions of outlining plan elements, identifying sources and considering context, then revisiting teaming and leadership structures. Part 2, Planning for capacity building, with essential functions of reviewing readiness assessment findings, and developing strategies to build capacity and strengthen motivation. And Part 3, Development of the Implementation Plan, which includes building work plan activities to get the intervention and agency ready, activities to roll out and measure implementation, communication and engagement activities, and then steps to consolidate and review the implementation plan. Feel free to go back and rewatch any of the videos in this series to refresh your memory. Remember to use the Implementation Planning and Capacity Building Workbook to reflect on your learning, record any outstanding questions, and think through your next steps. Join us for the other videos in this series to learn more about the essential steps for each part of the change and implementation process.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.